Imagine waking up one day with blurry vision, balance issues, and numbness that you can't explain. You brush it off, hoping it's just stress or fatigue, but the symptoms linger, or worse, they come and go without warning. This scenario is a reality for those facing multiple sclerosis, or MS, a mysterious disease that turns your own immune system against you, attacking the protective covering around your nerves. MS is unpredictable, it's often tough to diagnose, and its effects are deeply personal, varying wildly from one person to the next. Section 1. What is multiple sclerosis? MS is what's known as an autoimmune disease. In people with MS, the immune system mistakenly targets myelin, the fatty substance that surrounds nerve fibers. Myelin is like the insulation around electrical wires, it protects and helps nerves carry messages efficiently. When MS damages myelin, nerve signals slow down or get disrupted altogether. Over time, scar tissue, called sclerosis, can form, causing some symptoms to stick around permanently. Section 2. Why diagnosing MS can be so tricky. You'd think that with modern technology, we could simply run a test, find out someone has MS, and start treating it. But MS diagnosis is anything but straightforward. There isn't a single test that can confirm it, so doctors rely on a process of elimination. They use MRIs, spinal taps, and other tests not just to detect MS, but also to rule out other conditions with similar symptoms. The key factors in diagnosing MS are called dissemination in space and dissemination in time. This means doctors are looking for evidence of lesions in different areas of the central nervous system and over different points in time. Section 3. The tools doctors use to diagnose MS. Let's break down some of the most common tests. 1. MRI scan. An MRI helps doctors spot lesions or scar tissue on your brain or spinal cord, which can be a sign of MS. However, not all lesions mean MS. High blood pressure or even migraines can cause similar lesions, so this test alone isn't enough. 2. Evoked potentials test. This test measures how your brain responds to visual or auditory stimuli. Doctors place small electrodes on your scalp and monitor your brain's reaction time to things like flashing lights or sounds. It's a painless way to see if MS has slowed down nerve signals. 3. Lumbar puncture, spinal tap. This test checks for specific proteins and antibodies in your cerebrospinal fluid, CSF, that can hint at MS. A doctor uses a needle to draw fluid from your spine and then tests it for signs of an abnormal immune response. Though not used as often today, a lumbar puncture is sometimes necessary to rule out other potential causes of your symptoms. 4. Blood tests. These aren't used to diagnose MS directly but can rule out other conditions with similar symptoms, such as infections or vitamin deficiencies. 5. Optical coherence tomography, October. This is an eye scan that checks for thinning in the retina, which can suggest MS-related damage. It's not always a go-to test but can be helpful, especially for those with early visual symptoms. Section 4. Early signs and symptoms of MS. MS symptoms can be as unpredictable as the disease itself. Some of the earliest symptoms include vision problems, blurred or double vision, often one of the first signs, can be frightening. Fatigue. Unlike normal tiredness, MS fatigue can be overwhelming, even after a full night's sleep. Numbness or tingling. This can happen in the face, arms, or legs and often spreads gradually. Balance and coordination issues. Difficulty walking or an unsteady gait can make simple movements challenging. Other symptoms might come later or only appear in certain types of MS. These can include muscle spasms, memory issues, or even mood swings. Because MS affects people so differently, it's sometimes called the snowflake disease. No two cases are exactly alike. Section 5. Why an early diagnosis matters. If you or someone you know is experiencing these symptoms, seeing a doctor early on can be life-changing. Early diagnosis opens the door to disease-modifying therapies, or DMTs, which can slow down MS progression and reduce the number of relapses. These therapies are key to managing MS, and while they don't cure the disease, they can help many people lead fuller, more active lives. Section 6. MS treatment options. Managing MS involves a team approach, with specialists working together to create a plan that meets individual needs. Treatment can include disease-modifying therapies, DMTs. These medications aim to reduce the frequency and severity of MIS attacks, slowing down the disease's progress. Steroid medications. During a relapse, steroids can help reduce inflammation and shorten recovery time. Symptom-specific medications. Drugs targeting specific symptoms, like muscle relaxants, can ease discomfort. Physical therapy. PT can help maintain mobility, strengthen muscles, and teach strategies for managing balance issues. Counseling and mental health support. MIS can take a toll on emotional well-being, so having access to counseling or mental health support can make a difference. Section 7. Living with MIS. Most people with MIS will have periods of remission, when symptoms decrease or even disappear. However, the condition is progressive, so symptoms can worsen over time. MIS doesn't necessarily shorten life expectancy, but it can lead to complications if left untreated, like infections from limited mobility. The good news is, many people with MIS go on to lead full lives, adapting as they go. Conclusion: understanding your body. MIS might be hard to diagnose, but learning about the symptoms and understanding the diagnostic process can make a difference. MIS can take you by surprise, but by staying informed and acting early, you can take control of your health. Remember, if you're experiencing symptoms, don't hesitate to see a doctor. Getting a diagnosis is the first step toward managing MIS effectively and living well.